Hi everyone, my name is Sabrina Lamberti. Today I'm going to be discussing my projected evidence-based practice change on improving how we screen for postpartum depression in new mothers. The goal of my project is to address current gaps in early identification and referral for postpartum depression by improving screening practices using a validated and standardized tool. The clinical problem is postpartum depression, or PPD. It is a serious clinical issue that's often overlooked, and it affects about 13 to 19% of people after childbirth. Although it's so common, it's typically not diagnosed or may even go untreated. PPD can lead to serious problems like ongoing sadness, low self-esteem, trouble bonding with the baby, and delays in the baby's development as a result from trouble bonding with the baby. And if it's not treated, severe postpartum depression can also increase the risk of illnesses or even death. Because it affects both parents and newborns so much, it's really important to recognize it early so that it can be treated early. The gap in practice, so right now, screening usually only happens at the 6-week postpartum visit, but a lot of patients could either miss this appointment or push off the appointment, which would then push off being screened for postpartum depression. Additionally, hospitals don't have a standard screening process for patients when they are being ready to be discharged, so a lot of patients leave without being checked for early signs of postpartum depression. This leads to gap in follow-up care and fewer chances for early assessment, education, and referral, and as a result, important warning signs of postpartum depression can be missed during the most vulnerable time, which is after childbirth. The proposed evidence-based practice change. So to address this gap, I would like to implement more frequent use of the standardized screening tool, the Edinburgh Postnatal Depression Scale, or the EPDS. The screening would occur at 3 key time points. So the first time point would be prior to hospital discharge, so before they leave the hospital after having the baby. The second would be 1 week post-discharge, which would be via a phone call or online. And additionally, a 4-week post-discharge EPDS screening. That could be also over the phone or via an online source. And of course, the screening will occur naturally and normally at the 6-week postpartum visit as well as it usually would. If a patient screens positive at any of these time points, a plan would have been made for a structured referral pathway that ensures timely follow-up and mental health support. Predicting PPD prior to hospital discharge at a time when patients are available and reachable in the hospital allows for early detection, sets the patient up for success when it comes to treatment, and in the long run, it could lead to earlier treatment overall, more accurate identification of PPD, and improved outcomes for parents and families. Now, what exactly is EPDS? EPDS is one of the most commonly used tools to screen for postpartum depression that usually occurs at the 6-week postpartum visit. Here's an example of some of the questions that they would ask and the scoring level as well. It is a 10-question self-reported scale that looks at mood, anxiety, depression, and it is easy to use, it's patient-friendly, and it is often used in a clinical setting in the office. Why use EPDS? So I selected EPDS because it's a reliable tool that can screen with strong sensitivity and specificity. It's flexible. It can be given in person, it can be given over the phone, it can be given online, which makes it easier for people to access and use. And it is quick and easy to complete as well. The approach is evidence-based practice. So this project is going to use evidence-based practice, which brings together the best research, clinical experience, and patient preferences, which are all very important. This approach matches the national recommendations, including those from American College of Obstetricians and Gynecologists, which stretch the importance of regular screening for postpartum mood disorders like postpartum depression. And since PPD screening is already proven to work to initiate referral, use of an evidence-based practice approach is the best way to put this change into action. Now, the selected evidence-based practice model is going to be the revised Iowa model. So this model first came out in 1994. It was updated in 2017 to better fit today's clinical setting and evidence-based methods. The updated model gives clear step-by-step way to put evidence into practice, which is super helpful for projects that involve several steps and teamwork across different disciplines, like OBGYN. One strength of this model is that it focuses on involving everyone who has a stake in the change, so all the stakeholders are involved. It encourages nurses, providers, leaders, other team members to get involved early so everyone feels responsible for the change and knows why it matters. Another important part of this model is that it supports pilot testing. So this lets teams try to make the change on a small scale first, find problems, collect feedback, and make improvements before rolling it out to the entire unit. Lastly, the revised Iowa model helps teams keep change going over time. So it makes sure that the change becomes part of daily routines, policies, overall culture, and is not just a one-time effort. This is why it works so well for making postpartum depression screening a regular part of postpartum care. Why use the revised Iowa model? So I chose this model because it provides a clear step-by-step process that starts by identifying the problem, reviewing the evidence, and choosing the most suitable screening tool. Next, it helps teams to develop protocols that fit their own clinical settings, their personal clinical settings, such as maternal health. The model also supports teamwork across different disciplines, which is important for maternal and mental health. And lastly, the Iowa model encourages trying out changes, gathering feedback, and making adjustments so it works well for ongoing improvement. Now, the implementation plan has several main parts. So staff is going to be trained so that nurses and providers know how to use the tool, how to score it, and handle referrals. The EPDS will be added to the EHR, the electronic health record, so it fits into regular documentation routines. We will also set up standard steps for follow-up calls and early check-ins, and clear documentation rules will help keep things consistent and make sure the reports are accurate. The projected outcomes. So if we start screening earlier and we do it more often, we expect several positive results, such as finding postpartum depression sooner, referring people to mental health counseling and community resources more quickly, having better results for both parents and their newborns, making care more consistent and reducing differences in how the care is actually provided, and finally, keeping better records to help us improve quality and review our progress in the future. So the dissemination plan. There are several steps. So to help share these findings and encourage adoption across the entire system, the plan includes presentations by maternal health leaders, so management, staff training sessions, which would be run by an educator, sharing posters, sharing flyers, handouts, getting the staff accustomed to what they're going to be screening patients for. The information will also be shared through nursing committees, councils. They will be updated in policies to keep everybody informed and maintain consistency across the organization. Sustainability strategies. So to support the long-term sustainability of this, the strategies are going to be annual competencies and check-ins, re-education, EHR reminders or hard stops before the patient's discharged, monthly audits to track compliance. And all of these steps will keep practice change consistent and effective over time. Postpartum depression is a very significant health problem that often goes undiagnosed, unseen, and patients can really use earlier detection rather than just the 6-week postpartum visit. So I think that this project would really be beneficial for all patients and really impact their mental health in a positive way. here are my references following the APA 7th edition format. Thank you so much for listening.